Hi, hello friends. I am Dr. Natraj, respiratory physician, General Hospital, Alayadspur, Assam district. I want to share some experience in Corona in OPDs, not IPDs. If a patient come to hospital or clinic with any symptoms like fever, headache, cough, running nose, etc., just we'll tell them to get corona tested and we'll send them for RT-PCR center nearby. After giving some preliminary treatments like paracetamol, cetirizine, and antibiotics like erythromycin or doxycycline. Nowadays, we are getting RT-PCR within 24 to 48 hours. But previously, used to take 3 to 4 days. After giving RT-PCR test, patient will go with preliminary treatment with paracetamol, cetirizine, and antibiotics, and he'll go home and spread the disease to others. Because after taking preliminary treatment, some relief you'll get. But what I'm going to tell you is, you suspect such ill patients, take proper precautions. It may be PP kit, wearing a mask, double mask, gloves, and sanitizers. Ask the patient sit posteriorly. Patient will be back will be your side, his face will be other side. Auscultate infrascapularly, posteriorly. If cytokine is there, you will definitely get cryptations. Fine, coarse, or well-good cryptations. We don't know at what stage patient came to our hospital. Maybe day 1 of symptoms he may came, or day 5, day 7, we don't know. If you hear crackles or cryptations, definitely in this pandemic era, it is corona only. So immediately you can tell them, this is corona, you have corona, please isolate and give him aggressive treatment along with antibiotics, antipyretics, antihistaminics. We can start them with antivirals, steroids, and anticoagulants, along with immunobooster like vitamin C and zinc. By that, we can halt or check the cytokine storm and prevent the lung damage. Lung damage and preventing them for going for admissions, ICU requirement, oxygen requirement, and even ventilator, and you prevent death also. So, and ask the patient to be isolated. If you want, we can get him admitted also. Then we can take supportive investigations and chest X-ray also, whatever the facility available in that time. By that, we can prevent the spread to others. Will prevent the lungs damage and even death and complications. So, I request all of my colleagues who are maybe orthopedician, dermatologist, psychiatrist, pathologist or microbiologist, any faculty, please have a good stethoscope for at least for sake of kith and kin, family member, friends, and relatives. If you auscultate, you will hear cryptations, definitely isolate them, start them aggressively with antivirals like Flu if it is more than 94% of saturation, anticoagulant like rivaroxaban or abiraterone, and steroid like methylprednisolone or dexamethasone, along with the antibiotics and antihistaminics and immunoboosters. If saturation is less than 90 or less than 94, ask them to get admitted. Don't wait for the RT-PCR result. If possible, send them for CT, and you will definitely get the scoring. And if you go to IP, you will definitely get treatment with remdesivir, steroids, anticoagulants like enoxaparin, BAD or TAD, depends on severity, and oxygen therapy, nebulization, everything you want to get, along with good IV antibiotics. This can be done when you auscultate and get the crepitations. That's why take proper precautions and auscultate all your OPD patients with any symptoms, particularly posteriorly, infrascapular. You will get if you get crepitations, ask them for admission or isolation and start aggressive treatment. I discussed with the sonologist why this before CT, before RAT, before RT-PCR, we can diagnose the patient. What they say is, before anatomical changes, there are physiological changes. This gives you the crepitations while auscultating. If you properly examine and auscultate, even your bilaterally infrascapular, interscapular, you can give scoring also, CT scoring. You suspect scoring also. Sometimes my scoring are matched with the CT scores. Depends on the severity of the crackles we hear. So I request all of my colleagues to auscultate with proper precautions, posteriorly, infrascapular, all the suspected rat patient, the suspected corona patient, and prevent them from going for complication and spread to others. Thank you.